Well, good afternoon. Welcome to Leadership Lounge with Todd. And I'm excited today to be joined by former Health and Human Services Secretary Kathleen Sebelius, also former governor of Kansas. And today we're going to be chatting about her career, her learnings, her perspective on the world today. And ideally, we'll dive into some of the LGBT allyship that she's been leading and as part of Out Leadership's Global Advisory Board as well. Before we dive into the conversation, though, as always, I want to thank a few folks. I want to thank Out Leadership's 80 member companies for the support that they give us. This is, I think, our 15th vodcast since the crisis started, and I'm very honored and proud that we've been able to pivot so quickly to creating these conversations and bringing you the great content as if we were in our summits. And I want to highlight a few. I first want to highlight our global sponsors: HSBC, Greenberg Traurig, EY, Ropes and Gray, and RBC. And each week I try to highlight a few of our key member companies, and I want to thank the following this week: Paul Weiss, Sherman and Sterling, Barclays, American Securities, Coca-Cola, Capital One, KPMG, Caldwell Partners, Dow Chemical, Mizuho, Goldman Sachs, Hogan Lovells, and PwC. We really want to thank all of those companies for all the work that they've done and for all the support that they've given us. And without them, we would not be able to be bringing you the conversation today. So with that, I want to introduce Kathleen Sebelius, and with a very quick little background piece. I had the honor of meeting Kathleen actually through one of her sons a number of years ago, Ned, who was at the time working for the State Department, and he was one of the allies helping start and launch the Global Equality Fund, which was through Hillary Clinton's leadership at the State Department. And the Global Equality Fund was the opportunity to connect private companies as well as government organizations and nonprofits and governments themselves around the world to fund LGBT issues. And that it was a great champion, and we had a lunch meeting many years ago, and I became involved with the Global Equality Fund. Out Leadership became their first corporate partner. And we've gotten a number of our companies, including RBC and Morgan Stanley, to support the Global Equality Fund over the years. And at one point, Ned said, I think my mom would be really interested in what you're doing, and you should chat. And so fast forward, we actually had the honor of having Kathleen speak at one of our summits, and I was able to have Ned, her son, introduce her, which was tremendous. And then since then, I asked her if she would join our advisory board, and I'll never forget, she said, well, do you think I would add value? And I said, I can't imagine anyone adding more value. And she's proven it time and again with her advice and counsel. So we're incredibly grateful to her for her support, her leadership. And I want to thank you for joining us today, Kathleen.
Great to be with you again. Sorry, it's not in person, but this will do. And I like a fireside chat with a fire.
Right. Well, we always talk about fireside chats for years and years. And before the pandemic, there was never an opportunity, at least in my career, to do one. And now we can, and taking advantage of it. So I'd love to just start. I mean, I know people know you from the Obama administration and probably your governorship, but I'd love to start back earlier and kind of what drove you to get into politics and how you did. And, I remember the story you told about being insurance commissioner and I think the first Democrat in 100 years and the first woman, and you've been a trailblazer for a long time. Maybe can you just kind of take us back and give us a little of the beginning?
Sure. I'm an old lady, so this could take a while, but I'll try to make it very short.
You've got time.
I grew up in a political family. So I was introduced to politics as a child. My dad was on city council. He was in Congress, and then was governor of Ohio. We are the only father-daughter governors ever. So I grew up in Cincinnati. I also went to all-girls schools, and I say those two things because they're part of the story. Going to an all-girls school when I was raised in the 50s and 60s meant that you learned at a very early day that girls could do anything. President of the class, the athletes, the dumbest in the class, the ballerinas. There was never a time where girls could be the treasurer and boys could be the president. We were told, do it all, do it well, put your mind to it. So that was my framework: public service and no rules that were different from girls and boys. I got to Kansas by marrying a Kansan, kind of like those women in the early settler days, I came with my husband to his home state and ended up getting involved in politics as a volunteer early on, just because I was looking for my people and I wanted to have some base. I had no friends here. I had no family here. I didn't have a job. I had a husband. So finding a political group was a good idea. Ran initially for the legislature when our neighbor woman, Democratic legislator, said she wasn't going to run. And I'd been helping with her campaign. My kids were 2 and 5. My husband was a busy trial lawyer. And I really ran to go home. It was a much more family-friendly job. It was part-time. We lived in the capital city. I could go back and forth easily. I was a mile away from the Capitol and within a mile of my kids' school. So it was a much better work situation. Ran for that, as you say, after 8 years in the House, went for a crazy office, the elected insurance commissioner. Never a woman, never a Democrat in the history of the state, but won that office. And that was terrifying because nobody knew what went on in the office. 8 years of that, and then ran and won the governorship, served 2 terms, was elected twice. And along the way, I met Barack Obama before he ran for the United States Senate and became friends. His mother and his grandmother were Kansas women, and established an immediate tie that I needed a senator. I wasn't really fond of the Kansas senator. So I said, if you win, I'll adopt you as my senator. And he said, well, I don't really like our governor much, so you can be my governor. So we had a mutual adoption ceremony. And when he decided to run for president, I endorsed him and campaigned for him around the country. And then he asked me to come to DC to be in a cabinet. I wasn't really eager to leave my governor job. I had 2 years left on my term, but the opportunity to be in as the Secretary of HHS at a time with this amazing new president who was committed to passing a major health reform bill was something I couldn't pass down. So I went to Washington in April of 2009 and was there for 5.5 years.
So Kathleen, I want to go back though, because you're good at skimming over like all of these amazing accomplishments, and I want to go back to a couple of things. So you're in Kansas, and you decided you were to get into politics, and very few women are in politics at that time, right?
Correct.
And what was that like? What was the drive? You must, I'm sure you got knocked down, a million times. And I will reflect on a meeting that we had. You took me to Pharma after one of our meetings, and I remember you were the only woman in the room. And I just remember you come in, and this is obviously more recently, so you've had experience doing this, but you take no crap from anyone. You walk in, you're literally yourself, and you push through, which is I walked away from that meeting just so impressed. Is that how you've always been in your career? When you were starting out, did you walk into those rooms 30 years ago and have that gravitas and that sort of oomph?
Well, the reason I started this story with the 2 personal notes, growing up with a dad in politics, I hung out with him. I was often the only kid in the room. I had 2 brothers and a sister, but I was the one who was most interested. I think I was most interested in my father. So, hanging out at his political events early on, I learned a lot. I picked up a lot through osmosis, but also our family learned politics. I thought what every family did in the fall was go door to door and put up yard signs. Nobody ever told me there were picnics and football games, so that was part of my DNA. But I think, ironically, the nuns also are part of that DNA. To go to a school from kindergarten and all the way through college, where I was never told overtly or covertly, you can't do this. This is for boys. You've got to, know your place, know your role. That never occurred to me. So I was really taught from an early age, directly and indirectly, that I could do anything. And I kind of believe that. In Kansas, there were some barriers, but Kansas actually was a very welcoming place for women. When I ran for governor, there had already been a Democratic woman governor. I was the second. I was in a situation where, some of the boys, some of the union boys, some of the party boys were skeptical about me running for the legislature, and I just didn't wait to be asked. I think if you wait to be invited to the room, you may never be invited. So I just pulled up my chair, moved him out of the way, and said, I'm here. Let's go. And it seemed to work out pretty well.
I love that. It definitely did. And so the insurance commissioner role, tell me a little bit more about that. I think that was again groundbreaking, but you also, as I remember, you actually stirred a couple pots with that, and you pushed back on a lot of different corporate interests, and you weren't afraid to push.
Well, the elected insurance commissioner position is relatively unusual in the country. There are only 13 states with an elected commissioner statewide. Most states, the governor appoints the commissioner, who usually comes directly out of the industry, answers to the industry, and goes right back into the industry. Kansas had an elected commissioner for, a century and a half, but no Democrat had ever won that office. And it became the kind of money pot for a lot of other elected Republican offices. Insurance companies could put money through the commissioner's office and disperse it elsewhere. If you think about it, it's an office that's supposed to regulate the industry and look out for consumers. But, in a state like Kansas, it was really bought and sold by the industry that was regulated. It wasn't rocket science. If you sold insurance in Kansas, you gave a big check to the sitting commissioner. You then hired the lawyer he wanted you to hire. You brought your cases to the people in the regulatory office who were directed to you. And I thought it was kind of time in 1994. I had been in the legislature. I'd worked on insurance issues, but I thought this is an office. Didn't really know exactly what went on in there because, we didn't know anybody in the office, but I thought it has to have something to do with health insurance. It has to have some impact on consumers. And why don't I come at this with an interesting pledge? So I pledged as part of my candidacy not to take any money from anybody regulated by the industry. Well, while that sounded very novel and new, first of all, it was a way to educate Kansas voters because they had no idea that that's the way the office was run, that people could give money. But also, I wasn't going to get any money from the industry anyway. I was running against the incumbent. It was a relatively easy pledge to make, but it was a way to educate voters that, I kept saying, the commissioner needs to look out for consumers, not for the companies.
Right.
We need to make sure that when you buy a policy that you get the benefits that you're owed, that you have somebody to talk to who can navigate on your behalf, and that was a pretty novel argument in the mid 90s. Nobody had really talked about the consumer side of insurance. But I thought it was maybe something that people would understand and resonate. Nobody knew what the hell the office did. So it was a way to kind of say, they don't do this, but maybe if you elect me, I will do this. And that's exactly what happened. 94 was not a good year for Democrats nationally. I was the only statewide Democrat, think of this, in the nation to beat an incumbent in a statewide race in 1994. It was the year that Congress flipped, Democrats lost. We lost in Kansas, the governor's office. We lost our 2 sitting congressmen. We lost a bunch of seats in the legislature, but I won. So something about that message really got to people, and they thought it was a good idea.
That's amazing. Did it impact the other 13 states? Did any of the other insurance commissioners change how they did business? Because I assume they did business in a similar way.
Well, a number of them. So there were some models. The Pennsylvania insurance commissioner, even though he had been appointed, was really a consumer champion in the early 90s. So I kind of learned about the office from him. California ended up making the insurance commissioner an elected office after this had all happened, because they thought that is an important office to actually have answer to the constituents, not the company. So there were definitely some changes, and there was a movement at that point to get, we were still a pretty split group. Every state in the country has a commissioner, but there were those of us who were very consumer oriented, and there were those who were very company oriented, and those battles were fought inside the association. But it was kind of a new wave of consumer commissioners.
And so where is it now? I'm just curious. I mean, has it kind of come even further along that pathway?
Yeah, I would say so. I think that even appointed commissioners, particularly if they're appointed by a governor who is progressive, follow that line. Health insurance has become much more front and center in that office than it ever was. It's taken a real consumer role. So it's hard to be in the office and not be a consumer champion in at least some of the areas.
So then to governor now, how many female governors were there at the time you were elected?
Well, we built to a high of, I think there were 9 of us at one point. But I would say that the pivotal decision I made as insurance commissioner, which again resonated across our state, is as commissioner, I blocked the takeover of our Blue Cross Blue Shield company from a for-profit, from Anthem, a big for-profit health company, which was acquiring Blue Cross Blue Shields. And what was seen in the past, it was supposed to be just to check the box. It went through the shareholders and went through the board, and then it went to the insurance commissioner, who was supposed to just say, fine with me. And I looked at it and it didn't make any sense. I thought we would be much better off in Kansas to have a Kansas-focused company with a Kansas board, a relationship with health providers, and it was by far the biggest market company. About 60% of Kansans had health insurance with Blue Cross Blue Shield of Kansas.
Wow.
And so I said, no, this is a bad idea, and went on a series of hearings across the state and mobilized an effort, turned them down, was sued, won the case in the Supreme Court, and then ran for governor. So it turned out to be a very popular decision, and the company is doing very well as a Kansas-only company here, 20 years later.
Huh.
It was.
Did they thank you for that?
Actually, they did now. They didn't initially, but the consumers thanked me, the docs loved it, and it turned out to be great for the people, because we kept the decision making here in Kansas. But that was 2002 when I made that decision at the beginning of the year, and then I won the governor's office at the end of the year. So 18 years ago.
18. And so into the second term, you've got 2 years left. Obama says, hey, come do this for me.
Yeah.
And obviously that was pivotal, but also challenging, I can imagine. You said, you had 2 years left and you loved your job. What was the deciding factor for you in taking the Health and Human Services role?
It was the Health and Human Services role. So initially, President Obama had asked Tom Daschle to be his Secretary of HHS, nominated Daschle, and eventually Daschle withdrew. So in that interim time, he and Rahm Emanuel, who was the designated chief of staff, and others were coming after, saying, we want you to take a cabinet job. You can have any cabinet job. You can have any domestic job you want. We want you in DC. And I said, no, take my name off the list. Don't want to do that. Don't. And it actually goes back to our conversation, my older son, Ned, who at the time was a very willing, sometimes overly enthusiastic advisor. He had an opinion about everything I did, said, thought about. But in this one, he was absolutely right. He just said, Mom, do not leave the governor's office just to get a cabinet job. You want a job that you love and believe in and have passion about. And if you don't, it isn't like, I knew what they were doing in Washington because I've done it as a governor. When you pick a cabinet, you're trying to fill the slots, but also have a, geographical balance, a gender balance, a look at minority representation. You have a lot of pieces of the puzzle. So you're moving around people on a checkerboard. And I knew that's exactly what they were doing. And he just said, wait. So I had told the president-elect that, take my name off the list. I'll be finished with my term in 2010. you'll have slots, people will turn over, there'll be openings, and I'll come then. I'll come later, but I'm not going to leave this job that I love and care a lot about, to do something else. So when Daschle ended up withdrawing, the president came back to me and said, I'm not offering you this job, but if I offered you this job, would you take this job? And I said, yes, I would. So when I had gotten vetted for the 75th time and, went through the process, and they ended up saying they'd nominate me for HHS, I just thought at this moment, with this president, I can't possibly turn down being the health secretary, which not only has healthcare, but it is all of the Children and Families program. It's the Department on Aging. It's mental health. It clearly, as we know now, is the whole Food and Drug Administration and the National Institutes of Health and the Centers for Disease Control. So it had this amazing portfolio at any time in history, but at a time where the president had committed when he announced for president that he was going to push major health reform, I thought, I'm in.
And thank God you did. I mean, the output, despite all the headwinds, was tremendous and phenomenal. And we're eternally grateful, truthfully. I mean, what we have obviously has improvements to be made, but looking back, so let's do that actually. Looking back, what are you, when you think back about your time, so obviously Obamacare, so let's talk a little bit about that, but broadly, I mean, you said the whole portfolio, how do you what are the things you're proud of, and what are the things you wish you could have done that you didn't have the time to do?
Well, it's very timely in today's atmosphere and in this virtual world. On the 28th of April, the day I was sworn in, I was flown to DC, went to the president's office to literally be sworn in by the president of the United States, although he found out along the way that he couldn't swear me in because he doesn't have that authority. So he had the secretary of the office, whatever that is, hold, do the swearing in, and he could hold the Bible. It was because I was the last cabinet officer. And then I was taken from that room at 4:00 in the afternoon to the Situation Room because a call was underway with the Mexican health minister and the Canadian health minister and the head of the World Health Organization, because H1N1, the pandemic, the last pandemic in America, was underway. We knew that it was a strain of virus that hadn't been seen since 1918. We did not have a vaccine. And the most terrifying thing was the early presentation was that children were dying and young Americans were dying. So I had a pandemic in my welcome wagon initially. We had the Recovery Act, which had been passed a month before I came to DC, dealing with this economic downturn, which was huge, not in comparison to what we're seeing today, but 08 and 09 were not rosy economic years. But HHS ended up running. A lot of the money was put through our programs. Medicaid has helped to the states, big block grants to state and city governments, others. So those two pieces of the puzzle were already in place. And then the discussions about passing a major health reform bill were started. So to say it was a fire hose from day one was an understatement. I mean, the house was on fire, and just trying to get a handle on this amazing agency, which briefing for the cabinet hearings, the Secretary of Health and Human Services, because of the broad portfolio, actually has the great pleasure of having hearings with two Senate committees, not just one. So I had to have hearings at the Finance Committee and at the Health Committee. And in briefings for that, I was flying in and out of DC. I was, being a governor and getting briefed on aspects of this incredibly broad agency to be ready to answer what turned out to be about 14 hours of questions between the two committees and what they say is, they can ask you anything. They will ask you anything, and they will, this will all be on camera and on record and on. So I got a deep dive into at least the agency, and then I could not go to the office during those times because it is not considered to be good protocol to go into the office until you have the office. So I had never seen the office until I walked in the door, but it was very exciting.
That's unbelievable, Kathleen. That's so, healthcare reform is on the table, and it's failed, how many times in the past in U.S. history, and Hillary Clinton's piece and all of the, what made it work this time? I mean, obviously, it was a huge slug and a huge fight, but you did it. What was the difference?
Well, the amazing thing is, looking back on it, it was 15 months from the day the president was sworn in until the day he had the bill on his desk, which was almost unheard of. It seemed like 15 years, but it was really 15 months. And along the way, we lost the 60th Senate seat, which was an amazing blow. Teddy Kennedy had died, unfortunately, and his replacement turned out to be a Republican, much to the surprise of everybody. So we didn't even have the way to get an amended bill back on the floor of the Senate. So there were lots of hiccups along the way. But I think the big deal was we had a president who said, we're going big. We're going to go as far as we possibly can. There were lots of people around him who said, insure 25 kids and 3 senior citizens and call it done. Say you did your part and move on. Talk about something else. Do something else. And President Obama really believed, and he said this over and over again, and it again is a timely saying for today, cannot fix the economy until you fix healthcare. And so we're going to fix healthcare. Don't tell me to pay attention to the economy and not to healthcare, because they're so intertwined. And we're going to make sure people don't go bankrupt if they get sick. We're going to make sure people who don't have insurance have insurance. We need to push as far as and I have a moment, and I have some political capital, and I'm going to roll the dice and do as much as we possibly can. So at every point that there was a barrier or a blockade, or we lost a vote on this, or we had to go this way, he would come back to the table and say, is it still possible to go big? We're going big. Let's go. And it was really him at every step along the way when people were ready to throw in the towel that just said, nope, we're not doing it.
Wow. And it wasn't just on healthcare that he had that philosophy, right? I mean, it was on so many things.
Well, it was. And I would say one more thing that is really critical. And again, in this era, if Nancy Pelosi had not been Speaker of the House, we would not have a healthcare bill. I absolutely believe that, because I watched her navigate not only the bill through the House once, but the House is a big, burly, very broad-based organization. And from blue dog conservative Democrats to the most liberal faction. And she was able to find sweet spots and get the bill passed. But then the bill that the House passed was very different than the bill the Senate passed. The Senate bill was more conservative, more stripped down, a lot less progressive on lots of things that really mattered to Democrats. And when we lost the Senate seat, the only way to get the Affordable Care Act passed was to have the House take the Senate bill, which they then knew all about, and they knew how much worse it was in their view than the House bill, and pass it again. And she just said from the outset, I'm not sure I can get this done. But she worked a person at a time, and a coalition at a time, and a caucus at a time. And I was involved in a lot of those negotiations. And anybody else would have given that up along the way and said, screw it. We made a good effort. The House voted, we're done. But she would not let it go.
That's amazing. Well, so one of the things that I remember you chatting about a long time ago in terms of the LGBT inclusion in Obamacare and folks living with HIV and pre-existing conditions. And if I remember correctly, you were the champion for that.
Well, it was really important. Again, it was an opportunity to not only have some equity in the law itself, which we took very seriously, but also I worked for a president who said, we're going to look outside of the law, and there were provisions in the law that mandated equality of treatment, mandated that health providers deal with everybody's health needs. We started collecting data on the specific health needs of the LGBTQ community that had never been done before, added them to the health census. Because if you don't have data, then you're always dealing with anecdote. My friend says that this and this is going on, and that's interesting, but that's a lousy way to make public policy. So we actually gathered data. We had a very active civil rights division in our office who looked at things. But the president said, look, in addition to legislation, I want all of you to look at all of your administrative ability. When it became clear after the passage of the Affordable Care Act that we were not going to get much legislation done anymore, I want you to look across the agency, and I want you to turn up the levers of administrative authority. And one of the areas that we chose in the Department of Health and Human Services was the LGBTQ issues. And rather than having an office, which some people advocated for, but I saw that as a way to sideline the issues. This office worries about it, nobody else worries about it. We put together a task force, which was across this really broad organization. I asked for people to self-appoint. I appointed 2 openly gay leaders, but then we wanted people to step forward and say, I'm really interested in this. And we wanted them out of every division and every agency. And we wanted them to bring forward a series of policies that we could enact without legislative okay. Where were we missing pieces of the puzzle? And it was one of the most successful and amazing processes in all of HHS and in all of the Obama administration. We ended up, I think, changing at the end of the day about 250 policies, starting with things like nursing home, not hospital rules. The fact that you could define who a family was in a hospital for visitation. That we did the same thing for nursing homes. We looked at foster care, where kids went, who was denied. We looked at all the grants the department put out, and we basically said, if you cannot provide services across the board equally, don't apply for our grants. We are not going to give you money anymore to run a counseling program or an adoption service or whatever if you're going to be discriminatory. You don't have to change your policy. We don't have the authority to make you do that, but you cannot have government money to run a discriminatory program. So those kinds of things, we changed international policy, the way we dealt with the WHO, what kinds of issues came to the table. But that was probably, in addition to what was in the bill itself, that was probably the most sweeping change we made. And it affected children and family programs. We had a huge change in all kinds of aging programs and in nursing homes because HHS, it turns out, runs money everywhere. And the basic hook was, if you want government money, we're not going to make you take it. You can walk away from it. But if you want government money, your policies have to look like this. You can't discriminate in your office. You can't hire contractors who discriminate. You can't have rules that discriminate. You can't, and we will follow up on that. And that turned out to be a pretty damn effective thing to do.
Hugely, and made it a huge impact on the entire LGBT community. Just the fact that because of these rules, you could actually be defined as family and see your partner in intensive care, which so few people knew that was not the case until their partner was in intensive care and they were denied access because they weren't quote unquote family. That's just that one. And you had 249 others. That's just,
Well, and it was pre-marriage. So it was a time where you didn't have a marriage certificate to say I am family. You had to rely on this, what was a discriminatory and outdated definition. And it wasn't up to the patient to say who can visit me. It was up to the hospital. And we just said, no, that doesn't work. Can't do that. And if you want to turn down Medicare money for your hospital, that's fine.
That's fine. Yeah.
Turned out nobody did.
Right. Of course not. Right. But you can't take federal money and then discriminate.
Right.
Except now. Right. So what's of those 250 amazing administrative changes that protected our community, what remains? I know that adoption agencies cannot discriminate. I know that, is it 1448 is the rule that allows doctors and medical personnel to discriminate. And
That's right.
What,
Well, unfortunately, the Office of Civil Rights has been flipped on its head, and I would say it's now the Office of Discriminatory Rights, and they have begun to reinstate. Now, hospital rules will never change back. That's good news. Nursing home rules will never change back. A lot of in some of the children and families issues, they immediately withdrew support for foster families who were specifically geared to LGBTQ kids. They put discriminatory policies in place about who could adopt and who can't adopt. So some of those things, the good news is that can change back again, though. None of that has been codified into law. It won't be codified into law. So it can move back to a much more civil direction.
So the only way, of course, that will happen is if Joe Biden is elected. So let's talk about that. Eternal optimist, right? We gotta think positively here. So let's talk about Biden. How do you, if you're advising him, which I'm sure he's called you numerous times, and our buddy Rufus is now working for him full time.
Yeah, I saw that. That's great.
And going from out leadership to the potential administration, that's a pretty good jump. He has a more fun boss now, but
oh, that's hardly true. The parties aren't nearly as good. I can guarantee you that.
I agree, and we always have better tequila. So, what would you advise Biden now? Right? I mean, he doesn't have the bully pulpit of the presidency. He's got to do everything virtually. He's got to protect his own safety. I mean, how do you run a campaign like that? And what are you seeing?
Well, I think, they're figuring it out. That I think it would be a challenge in any, it's always a challenge to run against a sitting president. Let's start there. And the history is not on your side. Most presidents serve 2 terms. And there's a reason for that. I think the American public, gets, if things aren't chaotic and terrible, they say, oh, give the guy a chance, or he's done all right, or whatever else. Well, we have now a chaotic and terrible situation that, Trump did not create, but he has certainly poured gasoline on what was a flamethrower coming our way. So I think Biden is doing the right things, which is communicating. He's becoming much more digitally savvy. He's going to have to figure out ways to push out his message over and over again on all kinds of platforms. The Democrats do not have the kind of 24/7 message machine that Fox News is. When you have, basically state TV that is injected to the Republican Party, that's an enormous asset that is missing on, I'd say, our side of the ledger. And, the president is gifted at not a lot of things, in my humble opinion, but is a gifted communicator and knows how to drive outrage and knows how to manipulate and use messaging and to, at a minimum, confuse people and to certainly drive a message home. That again is an enormous advantage. He also happens to be able to fly around in Air Force One, be tested on a daily basis in the White House, things that normal Americans and even our presidential candidate cannot do, will not do. So there are some inherent disadvantages. Having said that, I think you don't have to convince anybody that things are terrible right now. What I think is most important about the race going forward is, first, I've been there and done that. So Joe Biden, among other things, ran the Recovery Act. And while people may have some debate and dispute about that, there's no question it saved the American economy. And we took a very different approach than some of the European countries do. So you can compare what happened if you had an austere and adequate response, which is what a lot of Republicans wanted and what they were hoping to do in America. We would not have recovered nearly as quickly as the United States did. And Donald Trump is the recipient of that recovery, months and months and months and years of job growth, which he happened to inherit and, takes full advantage of. But that really was part of what Joe Biden actually put on the ground and put together. So he starts there. But I think talking about what America could and should look like, what the differences are going forward, what the hope is that we can get out of this is also an important part of the message.
Well, so I'm curious about something that fascinates me as well, and it's a frustration I have with Trump. Of course, there are many of them, but the lack of integrity around literally basic facts and the 16,000 lies that have come out. And I'm struck by your career is marked with total integrity. From all the insurance commissioner pieces all the way through. You've created that career with that, and yet Trump has created a career in the exact opposite way. And I think Biden is in your school of, he's a classic politician. He wants to do what's right. He's driven by integrity. And I'm trying to understand how you sort of square that circle and how we can get people to, as Trump says, you can shoot anybody on Fifth Avenue, and people continue to believe him even in the face of like saying up is down. How do you fight that with Biden and others? I've yet to understand that.
Well, I think it absent the situation we're in, it would be extraordinarily difficult because it really is a world of two different realities. And I'm so proud to have worked in an administration where there was never a scandal, where there was never any hint of corruption, where nobody
there was a tan suit scandal.
Oh yes.
And there was no harm.
Season, or was it?
Yeah.
But I mean, you look by comparison, and it was actually a fact-based, scientifically driven. I worked in a department which felt that science was important and that we listened to the scientists. So the world is very different. One of the things I think, Todd, that is potentially a blessing out of this, if you can call it that. It's very hard to look at 80,000 plus Americans having lost their lives and the devastation that wreaks on families and family members and the kind of economic loss that people are living with, and say there's any blessing. But people, I think, have gotten a real crash course in how important government is. Yes. Somebody said sort of facetiously, everybody becomes a socialist in a crisis. And it's really true, because there are things that only government can do, that we don't want to be left on our own. We need economic resources, we need policy resources, we need protection, we need, health resources, and only government can deliver that. So that's a pretty good lesson 6 months before a critical election, that government really does have a role, that we don't want a laissez-faire, you're on your own, let the private market, if the stock market is up, everybody's up kind of notion. We want, we're taxpayers, we're citizens, we want our government to look out for us. So we start there. That's a good discussion for Joe Biden to have. He's not only a basically good and decent human being, but he believes there's a positive role for government. He's spent his life trying to make that role more positive. And I think, again, that's a good contrast. If you want somebody to, you have in the field I'm, most aware of and have worked in, science and health. I mean, we have an administration who is still pursuing a court case to take away people's health insurance, to take away health insurance from 20 million people in the midst of a pandemic. That's what they believe. That's where they think would be a big step forward. Joe Biden clearly doesn't believe that. So you've got, Biden thinks we should listen to Tony Fauci when you talk about reopening, and you should let the CDC publish the guidance that might help governors and individual business owners and others figure out what is safe and what is not safe. This administration doesn't believe that. So you're going to have some real-time ability to say, okay, this isn't making it up. And I think for the first time, Donald Trump is faced with saying what is an absolute lie on air, millions and millions of Americans hear it, and then having the facts side by side. We are fine. The virus is going to go away. It clearly didn't go away. it's going to be gone by April. It's now May. It isn't gone. Well, so we have a real time. It's not like a fact checker in the Washington Post who
Right.
2 days later says, "Oh, we'll give you a Pinocchio." This is like, I can look out my window and know that the guy's lying. I don't have to have somebody else tell me. I can look in the newspaper and know that, we have a huge outbreak in the meat processing plant in Southwest Kansas, and we have a president who's ordering people back to work. And it's not just the workers who are at risk. It's the owners of the companies, everybody who lives in that town. It's everybody who shops at that grocery store. It's everybody. So, that's happening real time. And people, for the first time, I think in this presidency, can say, the guy is a liar. And now those lies affect me. And they affect my family, and they affect, my parents, and they affect my ability to feel safe going to a restaurant or getting on an airplane. So they're now about me, and I don't like it.
Got it. I really think that's it. Right. I think maybe months from now, will he be able to spin his way out of that? But I agree with you. I think it's really hard to debate all of the facts that are happening around him.
Well, and for the first time, as I say, people can see the fact. I mean, when it's just theory and it's a he said, she said, and you think, oh, I'm just tired of that, I'm going to turn that off. But when it's about my life and my livelihood, then I pay a lot more attention. And I think people all over the country are paying a lot more attention. And, they will have a very stark choice to make. Do we think this is the way? First of all, did we do a good job, as is now being announced? Are we doing a good job? We have more disease than any country on earth. We have less testing per capita than most countries on earth. We have guidelines that are being ignored. We have a president who's urging people to go back out. I mean, his notion that somehow and I take it very personally, I'm a grandmother. I'm in the vulnerable age group. I may be in pretty damn good health, but I still am there. That I should be a warrior for him. I don't sign me up, sir. I am not ready to go to battle for you. I have a granddaughter about to be born in 2 weeks. I don't want my daughter-in-law in an unsafe situation. I don't want my new coming granddaughter to be in an unsafe situation. We're not warriors. We didn't sign up for this, and you screwed it up, and I want it fixed.
I think that should be one of Biden's taglines. You screwed it up, and I want it fixed.
Yeah. I mean, it's as simple as that. It's now about me, and, no more of the spin doctor stuff.
Yeah. Well, so the last two quick questions. I know you've got to go to another call with Congress. Two questions. One, what do you see in the future? Like if you like a positive outcome, as you said, it's a little silver lining-ish. And two, I know Obama finally spoke out, I guess, last week on a donor call, but, do we have hope of him doing more of that, do you think? Because I think, Becoming is now on Netflix, and everybody that I've talked to that has seen it is just bawling and looking back at what we had versus what we have. What are the chances of that, and what's the silver lining you think could come from this?
Well, let's start with the last part of that. I think there's no question Barack Obama will be suited up and ready to go on the campaign trail. And he has made that clear from the outset. He feels very uncomfortable about being the alternative president. He thinks we have one president at a time. He has said that from the beginning. But once the campaign is underway, his endorsement was a start. He didn't want to put his thumb on the scale in the primary. I think that's appropriate. I think everybody thought that was appropriate. But he was very active and engaged in the 2018 midterm elections. He was very much involved in that wave. And I don't think there's any question that both he and Michelle will be back full time, making the case for Joe Biden. Michelle has taken on voting and the fact that everybody should vote and be able to vote and be registered to vote as her focus on this, which is perfect. And so I think you're going to see a lot more of both of them. And, they both put verbs in all their sentences. They are elegant, compassionate, competent, and are just a reminder
Yeah.
what we had and what we should have again. And silver linings. I'm always trying to be an optimist. I think first of all, they're extraordinary acts of just resilience, courage, and kindness that happen every day in all of our neighborhoods, in all of our home situations, where you see people step up, helping a neighbor, helping a friend, providing extra resources to the food bank, putting extra supplies outside a house, saying, please come and take them, making masks and hanging them on, the clothesline, which a woman here did. She lives 2 blocks from the hospital, and she made 400 masks and just put them out on the clothesline and said, take them, please. And when these are gone, I'll make 400 more. But people who are just finding, the farmer from northeastern Kansas who sent one of his 4 masks to Andrew Cuomo. He said, we talked as a family, we only need 3 of the 4, and we want you to have one. I mean, that goes on every day, and that's happening in communities across the country. People finding ways to connect. I think that's a good thing. We are going to come out of this, unfortunately, with major gaping holes in our social structure, but they're kind of peeled back. I mean, we know the healthcare system really doesn't work for a lot of people a lot of the time, and hopefully that will be a push. We debated that for a number of years since Obamacare is now 10 years old. So the debate has been underway for 10 years. What's next? And I think what's next is going to look a lot different post-COVID than it did pre-COVID. People may be willing to make a much bigger leap forward and really get to the point where healthcare is a guaranteed right. I think that could be very good. I think there's going to be a lot of discussion about what education needs to look like going forward. There's always been this sort of mythology that online education is just the same as in-person education, and you can just flip. What we're finding out is that's really not the case, that there is something incredibly important about socialization in a classroom, about the interaction between teachers and students. First of all, I hope we'll pay teachers a whole lot more, but also we'll pay attention to, where technology really can either substitute or be an adjunct, but where it's really important to have that face-to-face interaction, things that, we kind of took for granted. Telemedicine is here to stay, finally. Yeah. I mean, what has happened in medicine is that's been accelerated probably 20 years by payers, by providers, and most importantly, by patients. They will never go back to the old days. So we're going to see advancements that were made in some areas that will change the way we do business and unpack a social safety net, as we've said, that really is going to desperately need some help. But I think the underlying really good news might be, again, reemphasizing the fact that government has a unique and very important and very positive role to play, and that there are things government can do both at the national and at the state and local level that cannot be done by the private sector, that cannot be done. And if government doesn't do it, nobody does it. And that, I think, is really important in a democracy, that people understand, see, and be ready to reinforce moving forward.
Well, Kathleen, I think that's a perfect spot for us to end on. And I want to thank you for being 4 decades of making sure that the government actually is moving forward, and for all of the work that you have done in your career and this tremendous career of public service. And for your support of the LGBT community every step of the way. It has made a huge difference in the lives of so many people you will never know. And I really, on behalf of the LGBT community and our leadership, I want to say thank you. And congratulations on the new granddaughter. I'm excited to see the pictures.
Thank you. All those boys in my family, 2 sons, 3 grandsons, I love them. But finally somebody on my team is arriving.
And I would imagine she's going to start canvassing in probably 3 years in the fall. So
she only lives 9 blocks away, so we'll see. We'll get her involved early.
Well, Kathleen, thank you again, and I look forward to continuing the conversation with you as we go through the summer.
That's great, and we'll sip a little tequila the next time we see each other in person.
Yes, ma'am. I look forward to it.
Okay, thanks, Todd. Keep up your great work, and Out Leadership's great work. It's really important. It's important nationally. It's important globally. But your voice and the voice of this organization and the wonderful sponsors and companies makes a difference every day. So keep it up.
Thank you. We will. I appreciate it.
Okay.
Take care.
Take care. Bye.